Hi, I'm Alex Howard, and I'm here with Sanna Anderson from the nutrition team at the clinic. And today we're going to be talking about the importance of treatment, especially on the nutrition side, but it also applies to the psychology side, of going in stages. Because I know there's been a number of people that have come to the clinic, especially with some of the research around mitochondrial function, for example, that have come in saying they want to have that specific treatment. Yeah. And I know that on the nutrition side, it's really important that we do things almost like in building blocks. Yeah. So maybe it's worth just explaining a bit about why that's so important for people.
Okay, I mean, without going into a great deal of detail, but I think it's probably useful to give some idea of how we look at the human body almost in some ways when we start working on nutrition. And I think, as you say, there is definitely a hierarchy to where we look. Or where we start from. I think one thing, first of all, to bear in mind, if I just sort of flip straight into the mitochondrial function, as you say, it is really kind of an exciting area, and a lot of people feel it can explain a lot of their symptoms. So, of course, it's something very tangible to almost sort of grab hold onto and say, this is what I want to do. The first thing I always say, well, look, actually, before we go anywhere, we need to make sure that you're digesting and absorbing, because you could be spending an awful lot of money eating a lot of mitochondrial supplements, first of all, not getting the most out of them, but also, the question you always have to ask yourself is, well, how did the mitochondria get to this sort of poor condition that it is at now? And one of the main reasons could even be that there is a very, very suboptimal digestive and absorptive situation going on. So whatever foods you're eating, you're not getting the raw materials to produce the energy, and therefore your mitochondria will start faltering. So if we take it down to that level, the great thing is that if we start supporting the digestion, absorption, getting in the basic nutrients, getting in the right proteins, getting in the right fats, getting in the right types of carbohydrates to give you more sustainable fuel, I do find that at times we never actually need to even get down to the level or up to the level of the mitochondrial function, whichever way you want to look at it.
Yeah, I think there can be a real tendency that people tend to still approach kind of physical treatments as like a pill for an ill, that it's like, I've got this thing wrong, so I want to have the pill for that, which I really understand, because people can they finally get a sense of what might be happening. Yeah. But it's really important, as you say, to get the foundations in place first, because it can also be the case that if you don't get the foundations in place, it's like you keep supporting the symptom without dealing with the cause of it. It's like, I like the analogy, it's like, someone's drowning in a river, someone jumps in and pulls them out, there's someone else that's drowning, pull them out, someone else drowning, pull them out. You spend all your time doing that, and you stop them jumping in at the start. And so sometimes you have to go back to find, what's ultimately causing something. And of course, I'm sure I know there are people which a digestion has been fixed and working, but the mitochondria still need support as well. But that's a next stage after dealing with that.
Absolutely, and I think, exactly as you say, I think what I find interesting about the nutrition work definitely is that you are moving away from the symptom management. So you're not just saying, okay, I've got a headache, let's get you something that kills the pain. But you actually ask, okay, well, why is the pain there in the first place? And again, why did the mitochondria falter? Was there a poor digestive situation? What does your diet look like at the very basic level? I think mustn't forget that it's not just about the pills. It is about the diet as well. It forms part of the kind of foundations of the program.
Yeah, and I think one of the things that to me I'm immensely proud of in terms of what we do is that it's much more patient specific than you come in with a set of symptoms and we give you a set of treatments for those symptoms. That it really is understanding in each case what's really happening here. And that's where the immense experience of you guys in the team, or you girls in the team, is so important, is really looking at each case and looking at any tests that have been done, any necessary tests that may be done, to be really clear that when you start a treatment program, you really know you're on track, rather than just, you've got those symptoms, take those supplements, see what happens. Because a lot of people obviously come to the clinic, having seen a number of nutritionists previously, taking all kinds of stuff that often they don't even need in the first place.
Absolutely. I mean, you're absolutely right. It really isn't one size fits all at all. And I think the majority of there's a big bulk of work in the initial consultation, and even prior to the initial consultation, when we get the new patient's paperwork, really starting to understand how that individual got to where they are now. So really understanding the underlying risk factors, potentially something that sort of weak areas that they were there right from birth, but then very much also all the environmental inputs, whether they are physiological, sort of psychological, emotional, because they will all have an impact. And you may end up even with the similar set of symptoms, but your route to that point has been very different. So therefore, when you start peeling back the layers, also your approach to how you're starting to sort of support and remedy the situation can be very different from one person to another.
No, absolutely. I think that's also one of the things that's just so important about the level of experience that there is in the team, is that it really is understanding how each case is different and therefore treating everyone as an individual. I know that you girls spend a huge amount of time in that, in obviously the departmental meetings discussing that to really understand what's really happening with people. Absolutely. So I guess, obviously people that are watching this that want to find out more about what we're saying, if they're not patients, 15-minute chats are a great way of doing that. And people that are patients, it's really helped people understand how the team actually work and why sometimes you may come in and you're really excited because you want to do a certain treatment program. And that's why it's really important that we look at a case in a lot of detail and then do things in the right stages, because ultimately that's what gets people to a lasting recovery more quickly rather than just fixing certain symptoms at various points. So great, thank you, Sanna. Thank you guys for watching. We look forward to talking with you again soon.